Are you ready for activity 8? I bet you are. Let's look at activity 8. Why don't you tell me what you got for the first one? We already went over the example last week, so we're going to go into number 1. A sprained ankle is an injury. Right, okay, it's not an illness and it's not a treatment. And number 2, fussy is a symptom. It's not an illness, it's not an injury, but it's a symptom. Sometimes fussiness happens when when a baby is teething. Sometimes fussiness happens when somebody's frustrated about not being able to do something. Sometimes fussiness occurs when somebody's hungry and hasn't had enough to eat. Or maybe when you're older, you get worried about something. Babies maybe don't get worried, but they can get fussy for different reasons, and that's a symptom. What about number 3, infection? Infection is an injury. It's not an illness, and it's definitely not a treatment. You don't want to treat somebody with an infection, do you? That would not be a way to cure them. And number 4, a broken leg. What is a broken leg? An injury, an illness, a symptom, a treatment? Which one is it? I think it's an injury, yeah. I had a broken leg, and I was injured, and I had to wear a cast. And then my injury got better. I recovered. How about number 5? What is swelling? Swelling, is it an injury, an illness, a symptom, or a treatment? It's a symptom, yes. It's a swelling. Swelling can be a symptom of an infection. For example, maybe you have swelling in your throat, and it could be a symptom of an infection in your throat. Maybe you have swelling on your leg because you fell down and got bruised, and the blood is pumped into your flesh there. Maybe it's because you have a broken wrist and there's swelling. How about number 6? Compression. Is that an illness, a symptom, or a treatment? That's a treatment, right. So compression is a treatment. When do you use compression? Okay, well, suppose you cut your finger and it starts to bleed. Do you just say, oh, look at all the blood, and watch the blood come out? No, I don't think so. What do? You compress it, all right? So when you use compression, you put pressure all around it. And so sometimes you can put a Band-Aid around it and put it tight enough so that the blood stops bleeding. And in the story we read, somebody had an injury, right? What was it, the injury? They needed compression. Do you remember? Do you remember in our story? Yeah, okay, so you remember that Carlos has had to put his foot up and put compression bandage on it. It was it Tomas? Yes, Tomas. Yes, because he stepped on a garden tool and he fell down and sprained his ankle. So they needed to put ice on it and use compression. Okay, so what else do we have? We have a rash. What is a rash? An injury, a treatment, or a symptom? Okay, it's a symptom. Okay, so sometimes you get a rash, like if you have diaper rash, not you, but your kids, your babies. If they have diaper rash, it's a symptom of what? Too much urine on their skin for a long time. That means you need to change the diapers more often, and the urine is making the skin get a rash. So you have to change the diaper or clean the bottom more often. If you have a rash on your arm, maybe it's because you're allergic to something like poison oak, or sometimes people eat things, right? Eat food, and then they get a rash as an allergic reaction. So that's a symptom. Number 8, what do you have for number 8? A stuffy nose. Is that a symptom, an injury, or a treatment? That's a symptom too. A symptom of what? When you have a stuffy nose, it could be could be a symptom of a cold, right? It could be a symptom of an allergy, right? Okay. How about, oh, that's it. Number 8 is done, finished. Okay? So far, so good? Any questions? All right.